Hello, everyone. Thank you for listening today. My colleagues will soon be able to present some information after the Prime Minister's press conference earlier. We will have the Minister of PSPC with us, and we will also hear from the Dr. Tam, who is the Chief Public Health Officer, as well as Dr. New, who is the Deputy Public Health Officer of PHAC. We will also hear from Major General Fortin, who is in charge of deployment, and also Dr. Sharma, who works for Health Canada. Before I give the floor to my colleagues and to Minister Anand, I would first like to remind you of a few important points. The interpreter would like to note that the sound quality is very poor. I would like to mention our U.S. allies who are going through difficult times, and also send our sympathies to the families and the loved ones of the victims of Flight PS 752, which was shot down a year ago. There are many people here in Canada and in the U.S. as well that were affected. We also heard from Minister Trudeau today a message of solidarity and of cooperation.
Turn to Minister Anand, who will provide us remarks on the vaccine delivery and administration within Canada.
Merci beaucoup, Jean-Yves.
Thank you very much, Jean-Yves. Before I begin, the interpreter would like to note that the sound quality is poor and is not allowed for interpretation at this time.
Je voudrais remercier tous les gens sur la première ligne pour leur travail important. I want to thank sincerely the health professionals across the country for their work as they continue to protect Canadians on the front lines. 2020 was extremely hard on so many fronts. And while we begin 2021 in the midst of a very serious situation, one that requires more resolve and sacrifice than ever before, we have real reason for hope. Aujourd'hui, je voudrais prendre quelques instants.
The interpreter would like to note still that the sound quality does not allow for interpretation at this time.
Today, we would like to take a few moments to update Canadians with regards to vaccines. I want to start by saying, while Canada has secured one of the most diverse and robust vaccine portfolios, we are now focused on getting doses into Canada at the earliest possible moment. That is precisely what we did last month when we secured early delivery of the Moderna and Pfizer-BioNTech vaccines, just as they were being authorized by Health Canada. Vaccine doses are now arriving at a steady pace, and we are on track to receive a total of over 1 million doses by the end of this month. I know many of us would like to see that rhythm increase. The rate of vaccine deliveries is increasing and will continue to do so. We are on track to receive 6 million doses by the end of March, 1.3 million doses of those by the end of January, 1.9 million doses by the end of February. These deliveries are being made on a schedule shared publicly and with the provinces. And Major General Fortin sharing those schedules with the provinces and territories. I want to assure Canadians that I, along with my colleagues at PSPC, are working nonstop to accelerate vaccine delivery schedules. Due to the earlier start of the deliveries in December. We are well on track to receive enough vaccines for everyone by the end of September. And let's remember, we are now at the beginning of January. I believe it is also important to remember that all of us at every level of government, in opposition, in media, and across the country, want the same thing: an end to the pandemic and a return to our normal lives. We are pushing the exact same direction, and we must continue to collaborate. Together, we will get through this. Thank you.
Thank you, Minister Anand. Dr. Tam, please.
And good afternoon. Bonjour à toutes et à tous.
Hello, everyone.
Over 635,000 cases of COVID-19 in Canada, including 16,579 deaths and over 80,250 active cases across the country. Nationally, the average case count is at 7,672 new cases being reported daily over the past week, and the number of people experiencing severe illness continues to increase. There are an average of 4,336 individuals with COVID-19 being treated in Canadian hospitals, and over 800 of whom are in critical care. And 136 deaths are being reported each day. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date, there have been 14 cases of a variant virus first reported in the UK, United Kingdom. As the rollout of COVID-19 vaccines proceeds across Canada, including during this initial phase to protect those at highest risk of severe outcomes or exposure, keeping Canadians up to date with timely, factual information is a top priority. The Public Health Agency of Canada is working closely with provinces and territories, Health Canada regulators, and other federal jurisdictions to collect information on COVID-19 vaccine safety. Starting today, the information will be posted on canada.ca and updated weekly on Friday afternoons. The weekly COVID-19 vaccine safety report will include information on adverse events following immunization, which involve any health problem that happens following immunization, but is not necessarily caused by the vaccine. Adverse events can range from common mild events such as soreness at the site of injection or a slight fever to more rare serious events such as a severe allergic reaction. Canada has a robust vaccine safety monitoring system in place, and all serious events will be investigated. As of January 1, there have been over 1,015,000 doses of COVID-19 vaccines administered across Canada, with 9 adverse events reported. There have been no unexpected vaccine safety issues identified to date. As with any new undertaking, we all have questions. These weekly reports on COVID-19 vaccine safety aim to provide Canadians with regular access to credible information that will assist them in making informed and confident decisions on vaccination for themselves and their families. As always, I call on healthcare providers to listen to Canadians' questions and concerns and to encourage ongoing dialogue to further support vaccine confidence. The progress we have made across Canada and around the world on vaccines is inspirational, but everything we've achieved is the result of consistent, persistent, and collective efforts. We've worked hard and we've kept up the pace. Though I know we are all eagerly awaiting more hopeful days ahead, we've still got a ways to go. We all need to maintain core public health practices, hand washing, masking, and spacing away any and all opportunities for COVID-19 to spread. And we wait for our place in the vaccine, as we wait for our place in the vaccine queue, let's continue to support those who need to be protected most urgently and do our part to help all those working to make vaccines available for all Canadians in the months ahead. Thank you.
Bonjour.
Hello, everyone. There have been over 735,000 cases of COVID-19 in Canada, including 16,579 deaths and over 80,250 active cases across the country. On average, daily 7,670 new cases were reported over the past week, and the number of people experiencing severe illness continues to increase. There's an average of 4,336 individuals with COVID-19 being treated in Canadian hospitals, and over 800 of whom are in critical care. 132 deaths are being reported each day. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date, there have been 14 cases of variant virus, first reported in the U.S. And as the rollout of COVID-19 vaccines proceeds across Canada, including during this initial phase to protect those at higher risk of severe outcomes or exposure, keeping Canadians up to date with timely, factual information is a top priority. The Public Health Agency of Canada is working closely with provinces, territories, to collect information on COVID-19 vaccination coverage and safety. Starting today, this information will be posted on canada.ca and updated weekly on Friday afternoon. The weekly COVID-19 vaccine safety report will include information on adverse events following immunization, or AEFI, which involve any health problem that happens following immunization but is not necessarily caused by the vaccine. Adverse events can range from common mild events, such as sores at the injection site or a slight fever, to more serious events, such as severe allergic reaction. Canada has a robust vaccine safety monitoring system in place, and all serious events will be investigated. As of January 1st, there have been over 115,000 doses of COVID-19 vaccines administered across Canada, with 9 adverse events reported. There have been no vaccine safety issues identified to date. And as with any new undertaking, we all have questions. Weekly reports on COVID-19 vaccine safety aim to provide Canadians with regular access to credible information that will assist them in making informed and confident decisions on vaccination for themselves and their families. And as always, I call on healthcare providers to listen to Canadians' questions and concerns and to encourage ongoing dialogue to further support vaccine confidence. The progress we've made across Canada and around the world on vaccine, everything we've achieved is the result of consistent, persistent, and collective efforts. We've worked hard and we've kept up the pace. Though I know we're all eagerly awaiting more hopeful days ahead, we've still got a ways to go. We all need to maintain core public health practices such as hand washing, wearing a mask, and avoiding all opportunities for COVID-19 to spread. As we wait for our place in the vaccine queue, let's continue to support those who need to be protected most urgently and do our part to help all those working to make vaccines available for all Canadians in the months ahead. Thank you very much.
Merci beaucoup.
Thank you very much. And now I will invite Major General Fortin to make his remarks. Thank you very much, and hello, everyone.
A deliberate and phased approach to Canada's COVID-19 immunization strategy. This initial phase, or phase 1, is characterized by a limited and steady supply of vaccines for much of January, February, and March, before we see a significant ramp up leading into April and the rest of the second quarter of the year. That said, we're working with our procurement partners and manufacturers to accelerate the delivery of approved vaccines as much as possible. As previously mentioned, a total of 6 million doses are expected to be distributed by end of March. Let me speak to Moderna and then Pfizer-BioNTech. Shipments of Moderna arrive every 3 weeks in this country. By the end of next week, 171,600 doses will be delivered, with numbers per provinces and territories similar to what we experienced with the last shipment. The first week of February, we anticipate another quantity, approximately the same, 170,000 doses. The quantities will begin to scale up to 250,000 in the month of February, and by end of March, or end of March, we'll have 1.24 million doses delivered. So by the end of March, we expect to have distributed 2 million doses of the Moderna vaccines. So those are the numbers that we have today. We are working with Moderna to accelerate the availability of vaccines, and that also applies to Pfizer-BioNTech. Pfizer-BioNTech deliveries will continue on a weekly basis. This week, 124,800 doses were delivered. That finished today. And they were delivered to 68 different vaccine delivery sites across the nation. For the remainder of January, we expect approximately 208,650 doses to be delivered to the provinces weekly. In February, we expect to receive between 366,000 and 367,000 doses of the Pfizer-BioNTech vaccine per week. Shipments in February include, therefore, a 60,000 doses more per week than we originally planned, and represent an advance on Canada's March allocations. So the total expected of Pfizer in February is 1.4 million doses. So we're working with our procurement partners and the manufacturer to confirm Pfizer-BioNTech allocations for March. And by the end of the first quarter, we'll have received at least 4 million doses of that vaccine. As our collective understanding of these new vaccines evolves and the manufacturer update their product monographs and instructions, we're able to adapt how and where we distribute and administer vaccines to Canadians. Within the past week, Pfizer-BioNTech has updated their guidelines and procedures for the transportation of their vaccine in a thawed state and in smaller tray sizes. So this means that more options for that vaccine to be transported and administered to more sites and in smaller amounts, and that helps tremendously provinces in the administration of the vaccine. This complemented with our inherent flexibility to deliver to an increased number of vaccine delivery sites across the Canadian landscape, as identified by the provinces, and our growing capacity to support multiple cold chains is very good news. The allocation forecast will continue to fluctuate on a regular basis. This is an expected result of ongoing and persistent efforts on the part of Government of Canada to work with manufacturers to accelerate the availability of approved vaccines and of natural disruptions that can occur during forecasts as they evolve. So we'll continue to work together with all our partners to ensure that we have collective capacity to immunize as rapidly as possible and as safely as possible. Maintenant en français, nous poursuivons.
Now in French, we're pursuing a deliberate and phased approach to Canada's COVID-19 immunization strategy. This initial phase, Phase 1, is characterized by a limited and steady supply of vaccines for much of January, February, and March, before we see a significant ramp-up leading into April and the start of Q2. We are working with our procurement partners and manufacturers to accelerate the delivery of approved vaccines as much as possible. As previously mentioned, there's a total of 6 million doses expected by March 31st. First, I'll talk about Moderna, and then I'll move on to Pfizer-BioNTech. Shipments of Moderna vaccines arrive every 3 weeks. By the end of next week, we expect 600,000 doses to be delivered, with numbers per province and territory similar to the last shipment. We also expect roughly the same thing, namely 170,000 doses of this vaccine during the first week of February. Quantities of Moderna vaccine will then begin to scale up, with 250,000 doses expected by the end of February and 1.24 million doses in mid-March. So by the end of March, we expect to have distributed a total of 2 million doses of the Moderna vaccine. We continue to work with Moderna, obviously, to accelerate the supply of vaccines, and we will continue to inform Canadians as figures are more stable. Now, in terms of Pfizer-BioNTech, these vaccine deliveries will continue on a weekly basis. This week, 124,800 doses were delivered to 68 vaccine delivery sites across the country. For the remainder of January, we expect approximately 200,650 doses to be delivered to the provinces weekly. In February, we expect to receive between 366,000 and 367,000 doses of the Pfizer-BioNTech vaccine per week. Shipments in February include, therefore, 60,000 more doses per week than initially planned and represent an advance on Canada's March allocations. Therefore, the total of the Pfizer-BioNTech vaccine for February is 1.4. March will be more challenging, and by the end of this quarter, we will have obtained at least 4 million of this vaccine. In terms of the transportation of the vaccine, as our collective understanding of these new vaccines evolves and the manufacturers update their product monographs and instructions, we are able to better determine how and where we will distribute and administer vaccines to Canadians. Over the past week, Pfizer-BioNTech has updated their guidelines and procedures for the transportation of their vaccine in a thawed state and in smaller tray sizes. This means that we can transport smaller quantities easier to areas where provinces can administer the vaccine. This makes our flexibility greater to deliver an increased number of vaccine sites across the Canadian landscape, as our growing capacity to support multiple cold chains. And this is good news for Canadians and our immunization strategy. In terms of the fluctuation in the number of doses, so our forecast will continue to fluctuate regularly, and we expect our government to pursue its efforts and is working closely with manufacturers to accelerate the availability of vaccines. Our allocation forecasts will certainly fluctuate as changes occur during the vaccine production process. It is a new vaccine, and we will continue to work with our federal, provincial, territorial, and Indigenous partners, as well as the public, as things evolve. In conclusion, we will continue to work with all our partners to ensure that our collective capacity to immunize permits available vaccines to be used to greatest possible effect as quickly as possible. Thank you.
Thank you, Major General Fortin, for this excellent summary and this encouraging news. I would like to invite Dr. Sharma to speak. Dr. Sharma est la conseillère médicale en chef de Santé Canada.
Dr. Sharma, Health Canada. We'll start with questions. Thank you very much for these speeches. We'll start with 3 questions from the phone, and then we'll take questions from the room. First question.
Merci. Thank you. Please press star one if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. Notre première question est de Madeleine.
First question from Madeleine Blémorin from Radio-Canada. The floor is yours. Question. Hello. When you talk about the target for September 2021 for all Canadians to be vaccines, I'd like you to be more specific. Does this mean that Canada will have the necessary doses to vaccinate all Canadians, or does this mean rather that Canada will have vaccinated all Canadians by this point?
Madame Anand?
Ms. Anand?
Thank you so much. I hope you can hear me. The numbers that we have been providing, and in particular our procurements of a minimum of 214 million doses and a total of up to 398 million doses with options, are dependent upon Health Canada approval of certain vaccines. We know that Health Canada has approved Pfizer and Moderna. We know that 2 additional vaccine candidates are in rolling review with Health Canada, being AstraZeneca and Johnson & Johnson. And so the numbers that we are using for our predictions are based on the assumption that the vaccines that we have procured will indeed be approved by Health Canada. Je voudrais aussi
I would also like to add that there's a lot of work to be done with the suppliers to ensure that they can provide the necessary information to Health Canada so that their vaccine can be approved. We're working hard with manufacturers in this respect. Thank you very much. Dr. New, I would also like to add something in terms of our prospects. Our question is really focused on, well, we're on the right path to be able to offer approved vaccines to all Canadians when they're eligible, and to tell Canadians that we have the vaccines. So we encourage Canadians to be vaccinated, but we're not going to force anyone to do so. It's always a question of offering the vaccines. Follow-up question. Things to be really clear. Or by September, will we have vaccinated all Canadians who wish so? There could be a difference here. By the end of September, will we have the necessary doses, or will by the end of September will we have vaccinated everyone? There's a difference between having the doses and having vaccinated everyone.
Oui, c'est vrai.
Yes, that's true. And thank you for your question. I'd like to start by saying, in my opinion, we have to think about this in 2 phases. First, we have to have the doses here in Canada. And as soon as possible, we are going to give these doses to the provinces and territories. That's the second phase. And in terms of the federal government, we're going to ensure that the doses will come here to Canada, and the provinces and territories must do their share in terms of these operations. And perhaps the General Major Daniel Fortin could add something here as well. Certainly. Thank you very much, Minister. I can say that I have confidence, first, that the quantities will increase significantly as of April if these vaccines are approved. There are other vaccines that could be available when they're approved, but I'm working on what's been approved, and these doses will increase significantly in April. Now, the provinces and territories are developing their expertise in terms of handling and administering these vaccines. And these vaccines are more complex than what we've seen in the past. It needs experience and expertise, and this is increasing every day. There is no reason to believe, and as my colleagues also feel, no, rather, I believe that the provinces and territories will considerably ramp up their ability to administer vaccines in the coming weeks and months. And together, because this is a team effort, we'll continue to look at how we can prioritize, distribute this equipment to best meet needs and cover areas, encourage the sharing of best practices, and use federal contracts as much as possible with respect to distribution to facilitate the work of provinces and territories. Very quickly, the question was very relevant. There's always a closer cooperation between the government and the provinces in terms of delivering the vaccines, and the provinces and territories are administering them. And like Prime Minister Trudeau said, and as Mr. Fortin said, these two things will be happening in parallel.
I'll repeat this quickly in English. I think we have no reasons to doubt that provinces and territories will significantly ramp up their ability to administer vaccines over the next weeks and months as we collectively gain more knowledge and experience with administering vaccines, and certainly our role in terms of distributing at scale to those more remote areas. So provinces and territories can leverage a federal logistics service provider contract to maximum extent. We can prioritize distribution of cold chain enabling equipment, freezers, and all these other things that will help the provinces and territory to administer at scale. And as more and more vaccines become available, it's important to encourage the sharing of best practices, and that's already ongoing with the conversations that we have amongst all key partners.
It's Dr. Maybe I'll just add a bit of a public health perspective. I think that the question about, what happens by the end of September, I think, we are vaccinating people right now, obviously, into priority populations. And I think as more and more Canadians become vaccinated throughout the country, confidence will grow. People will see, a neighbor, a friend, a coworker is getting vaccinated. And so as, the summer months roll on, by the time we hit September, hopefully, like I said, there's just be a few more pockets in terms of Canadians who, for whatever reason, have not taken up the offer yet, and then we'll still obviously reach out to offer the vaccination to those remaining Canadians who are obviously eligible to get vaccinated. So I think that's the overall game plan. And to date, obviously, the federal government is working very well with our provincial and territorial counterparts, and things are unfolding as Major General Fortin has said, and I think it's only going to unroll even faster and better as we proceed further. Thank you.
Next question, please.
Thank you. Merci. Our next question is from Ryan Timothy from the National Post. Please go ahead. À vous la parole.
Yeah. Hi there. I was hoping to get a little bit more clarity around this September goal. My understanding is that you expect Pfizer and Moderna to deliver their combined 60 million doses by September, which I think would cover off the vast majority of Canadians who want a vaccine, especially factoring in that people under 18 can't currently receive it. It's not approved for them. Is that correct? Are you expecting to have all of those Pfizer and Moderna vaccines here?
Ryan, nice to hear your question. I will say that our thinking in terms of providing the data to Canadians is based on the expectation that we will have additional vaccines approved. And so the numbers that we've provided take into account a number of vaccines, not only the Pfizer and Moderna vaccines. By the same token, we wanted to be sure that we would be able to have approved vaccines in place to ensure that Canadians can be vaccinated And that's one of the reasons why we moved to exercise those 20 million additional Moderna options prior to the holidays. And so it's really a multi-pronged approach to make sure that we have vaccines in place for all Canadians this year prior to the end of September.
Follow up, Ryan?
Yeah, so I'm still not clear, though. Do you expect the 60 million doses from Pfizer and Moderna to be delivered by September as part of this goal of vaccinating everyone who wants a vaccine by September? And also, I guess, wondering if you can give us an update, too, on where we are at with the approval. If these vaccines are key, where are we at with the approval for Astrazeneca and Johnson & Johnson?
Okay, well, I will take the first question since I'm not Health Canada, and it's difficult for me to provide an update on the regulatory process, given that I'm not involved in it. But in terms of the Pfizer and Moderna numbers, yes, in large part, we are planning that Pfizer and Moderna doses will comprise the number of doses required to make sure that any Canadian who wishes to be vaccinated will be vaccinated by the end of September. Again, we are in conversation and negotiation with the vaccine suppliers, with Pfizer and Moderna every day. I have spoken with the CEOs of both companies this week already, and I will continue to engage with them, as will my department, to move up doses from Q3 to Q2, from Q2 to Q1. We are pressing on all fronts to do whatever it takes to make sure that we have vaccines in this country as soon as possible.
Thank you, Minister Anand. I am not in the room and therefore cannot see if Dr. Sharma would like to provide precisions on the regulatory process.
I would. Thank you very much, Minister. So this is Priya Sharma from Health Canada. So the question is regarding the rolling reviews of both the Johnson & Johnson and AstraZeneca vaccines. So both of those are under review. They are prioritized, expedited reviews, and the teams are actively working on them. We're also working internationally with our counterparts on those reviews. With respect to the Johnson & Johnson review, we are expecting some key clinical information coming in from clinical trials that are expected to read out around the end of January or into February, but that's been a little bit variable. And we also need some key manufacturing information. So there are still large chunks of information on that submission that we're expecting. With respect to AstraZeneca, we have done a review of the data that we have so far, and we are working with our key regulatory partners, including the European Medicines Agency, as well as the US FDA. And there are still some clinical questions that we need to look into. So on the safety side, on the efficacy side, as well on the quality side, on the manufacturing side. There is a large AstraZeneca study that's ongoing in the United States. And we still are expecting to get some information from that study. So that's almost 40,000 participants. So the reviews are progressing. They're progressing well. As we said, we're working very closely with our international partners, but there's still some questions to be sorted through before we make a final decision. As we get closer to making the final decision, absolutely we'll share that information.
Okay, we'll take one more question on the phone and then turn to Ron.
Thank you. Notre prochaine question est de
Our next question from Catherine Levesque, Canadian Press.
Oui, bonjour.
Hello, everyone. My first question is for General Fortin. My colleagues on TV and radio, well, they talked about a lot of figures in terms of upcoming deliveries. By the end of March, how many doses in total can we expect from Pfizer and Moderna? Can you answer that? And also give us an indication as to whether the figures will increase considerably in phase 1.
Oui, alors,
I'm just doing my math quickly in public here. It's in February, 1.4 million doses from Pfizer. And by the end of March, we expect to have reached 4 million doses from Pfizer. We expect to reach 2 million doses from Moderna by the end of March. Given we had 160,000 already and we'll have 171,000 next week, we're expecting 1.67 million doses coming in coming months. Follow-up question. Question, yes. For that, thank you for that math. And my follow-up question is for Mr. Duclos. Mr. Leblanc's not here, so I'll ask you. I'd like you to talk about the $1,000 for travelers. That was controversial. We're expecting news to change the legislation by the end of the week, and it's already Friday. So do you have anything to announce today about that? And where are you in terms of discussions to amending the legislation on that benefit? Thank you very much for your question. It's useful to remind people who don't understand the context that this benefit will not be given to people who did not follow public health directives and decided to travel. This benefit will not be offered to them. It's clear. And I'd like to remind everyone that this benefit will be changed so that people do not receive this benefit, and it will be done appropriately, legislatively, and that is why my colleague, Minister Qualtrough, and other ministers are already working on this within the Canadian government and with other parties in a minority setting so that we can make the necessary changes. But Prime Minister Trudeau reminded everyone just a few days ago that these travelers will not receive the recovery sickness benefit when they have.
I'd like to hear what you have to say as well. A number of provinces are saying that they're going to run out of vaccines soon. Major General, you've said today too that the provinces can expect, or you expect that the provinces will be able to significantly ramp up their ability to give out vaccines. So do you agree with the assessment of Premier Ford that Ontario, for example, is going to be running out of vaccines soon?
Thank you. I think
I'll start. If
Go
that's
ahead.
okay, Danny, and then I'll turn it over to you. I want
Go
to
ahead,
start,
Minister.
Mackenzie, by saying that we are all pushing in the same direction. We are all cognizant of the fact that this is the largest mass vaccination program in Canadian history, and that I'd like to say that the province's work to date, especially over the past week, has been impressive as they work to increase their own capacity to administer vaccines. It's important to remember also, from a federal procurement perspective, that we have been clear with our delivery schedules. We have been clear that we will be ramping up with the doses that we are delivering to the provinces. In fact, we will be doubling the vaccine deliveries from January to February alone. This is information that the provinces have and that they can use for their planning purposes. So the phrase running out of vaccines has to be taken into that, in that context. That is, that the schedule is in existence, it has been shared with the public and the provinces, and the planning should take place on the basis of that schedule. And
Go
now
ahead.
I'll turn it over to Danny Fortin.
Thank you, Minister. The only thing I would add is that we're working very closely with provinces and territories, of course, and we're providing as much visibility as possible. Our numbers are their numbers. They have visibility on what's coming in January, both January and February, and can plan accordingly.
So it seems like we won't be running out. It's just that we'll have more capacity to be able to dole out vaccines compared to the number of vaccines that we'll have. That seems to be the point that you're making. But I'll ask my follow-up question. for Minister Anand. Israel has, I think, 1.6 million doses of the vaccine, and that's in large part because they paid a premium price for it. They've come out and said that they've paid $30 a dose. The Americans have come out and said that they paid $19 a dose for Pfizer. Is the reason that Canada doesn't have nearly the same number of vaccines as Israel, a smaller country than us, who signed a deal much later than Pfizer with us, is because we were not willing to pay the premium price that Israel paid?
Thank you, Mackenzie, again for that question. I want to start by saying that we put everything on the table with the vaccine companies in our negotiations with them. And so the short answer to your question is we did put price on the table, of course, as well as a number of other factors. And it is as a result of our very strong position at the negotiating table that we were able to sign with Pfizer and Moderna first, that we were at the front of the line for Pfizer and Moderna, that the chair of Moderna came out and said we are at the front of the line for Moderna. And in my conversations with these companies every day, that point is clear, that Canada is a jurisdiction that they are serving and servicing. And we will continue to work with those suppliers to accelerate deliveries earlier and earlier in 2021. That is the work that I am doing and the work that my department is doing every single day.
Tonda?
Hi, I just want to come back to the idea that the provinces say at least 4 of them have come out and publicly blamed the federal government for their fluctuating and unclear numbers and the inability to plan properly and to get the doses out. So what is the problem? Is it that the provinces are overbooking vaccinations and that they don't have vaccine for, that you've told them what their numbers are and you've delivered? Have you ever not delivered the doses you said you would deliver them? What's the problem?
I will start and then hand it over to Major General Fortin. We have been very clear with the provinces and territories about the numbers of vaccines that we are procuring and that are arriving in this country. We continue to share those tables with them in a very collaborative way, and we will continue to do that because we need to work collaboratively to ensure that Canadians are vaccinated. I will now turn it over to General Fortin because he is on the front lines with the provinces and territories every day.
Thank you, Minister. Thanks for the question. I think back in mid-December and December, we certainly had a number of uncertainties, and there's a number of factors at play here. But there were a number of uncertainties, and when vaccines become regulatory approved, and we have more fidelity on able to build a solid plan. We've been working with a number of assumptions and sharing planning data in full trust and confidence with provinces and territories. But we are now in a position to share a lot more. As you got from my statement, we have visibility on January and February, like solid numbers to work with, which will be tremendously helpful now to provinces and territories. So they have a lot more line of sight, predictability. More equipment is also being distributed at a pretty steady pace to ensure that we have an ability to administer to move down to the last mile and administer by provinces and territories.
If I may add a very brief additional remark. As the Prime Minister said this morning, this is the largest and most complex immunization campaign ever seen in this particular country. So there is, and there is still going to be some unknown and some uncertainty. But as the Prime Minister repeated again, this is a whole of Canada campaign. We are going to increase even more our collaborative capacity with provinces and territories to make sure that this is the success that Canadians expect and Canadians will obtain.
Okay, we'll go to the phone for one more question and come back to the room. Oh, sorry,
Oh,
my mistake, Tonda, go ahead.
Thanks. So maybe you could help me understand, and I still don't have an answer to the fact that why then are places like the University Health Network saying that they've run out and they've got 3 more days of appointments booked for people to get vaccinated, but they don't have vaccine. What's happening there? Are the provinces or those facilities overbooking when they don't have vaccine in hand? Is that what's going on?
Major General Fortin?
Yes, thank you. Well, I can't comment about Ontario's immunization plan or University Health Network bookings and plan. But what I can tell you is this: we provide as much clarity, as much visibility as possible on the doses available as we firm up those numbers with the manufacturers, and it's a collective effort, and we're very much in daily conversations with provinces and territories. The ramp up can be difficult because there's a desire to immunize at scale. The vaccines are coming. We've said all along 6 million doses between when we started in December to, it's possible, all Canadians will want the vaccine.
Okay, and now we'll go to the phone for one last question, then back to the room for one last. Thanks.
Thank you. Our next question is from Jaela Bernstein from CBC News. Please go ahead. À vous la parole.
Hi, I believe this question is for Dr. Sharma. Quebec Public Health is saying that the first dose of the Pfizer vaccine is actually around 92% effective just after the first dose, based on its interpretation of the data, though it has acknowledged it doesn't know how long that protection will last. But I haven't seen that 92% number anywhere else. And in fact, I've seen the FDA cautioning against interpreting the numbers that way. I'm just wondering how public health is interpreting the effectiveness of the first dose.
Thanks. It is Supriya Sharma. Thank you for that question. So in terms of the effectiveness of the vaccine before the second dose, I think the first thing to really make sure that we stress is that this is both the Pfizer and the Moderna vaccines are 2-dose vaccines. So in terms of getting to that peak effectiveness levels, you do need the second dose. And depending on which vaccine, it's either after 3 weeks or after 4 weeks, and it's either measured 1 week after that second dose or 2 weeks after that second dose. The difference in the numbers in terms of what the effectiveness of that interim period is, so between the first and second dose, depends on when you're making those calculations. So again, this is a little bit of detail, but with Pfizer, we've said that before the second dose, so after the first dose, it's got a 52% efficacy, whereas some people have done the calculations and have read either that same data set as 89% or 92%. And the difference in terms of those numbers is because some people, when they do the calculations, take out the first 2 weeks after you get the first dose. So basically they're saying, wait, that's not fair to be doing an assessment of the effectiveness of the vaccine for that whole time period because we know it's not instantaneously effective. We're going to take out, depending on the way that they've done it, the first 10 days, the first 12 days, the first 14 days. So you'll see different levels of effectiveness based on how those numbers are assessed. It's really important to note that the studies were not designed to look for that sort of information. So this is a bit of a back of the envelope calculation on that. The other part of it that I wanted to just raise is that I think a lot of people are interpreting the efficacy, the effectiveness of the vaccine as sort of, if somebody gets the vaccine, you can take a blood test and you say you're at 95% or you're at 89% or you're at 52%. That's not really the case. The effectiveness of the vaccines are measured based on how many cases you see in the group that did not get the vaccine versus how many cases you saw in the group that did. So if you're talking about a 3-week period for Pfizer between the doses or a 4-week period between the doses in Moderna, if you take out those 2 weeks in the front end, you're really only looking at 1 week for one vaccine and 2 weeks for another vaccine. And so that's a very short period of time to be looking for cases. So the last piece is that when we look at those other calculations, so the 92% or the 89% effectiveness for those vaccines before those doses, it really is kind of based on, as we said, those calculations, and we don't know what that really means. Does it mean that that likelihood of not getting the disease continues for a long period of time, or is it something that's short-lived? So, you know, I think both the assessments are appropriate. There's different ways of looking at the data, but the bottom line is these are 2-dose vaccines. You should get the second dose. The second dose should be as close to the approved schedule as we can. And the way that we know about the 95% or the 94% effectiveness is really based on getting that second dose, and we're still monitoring to see how long that effectiveness lasts.
Follow up?
Minister Anand,
Yes,
would you like to add some precisions?
A follow-up question.
Thank you, Jean-Yves. I'd just like to add something to Dr. Sharma's remarks. From a procurement perspective, the issue of the second dose has arisen in our conversations with both Pfizer and Moderna. And it is very important to remember that the recommendation from the manufacturer based on the clinical trials, and I assume their conversations with Health Canada, is that the second dose should be administered as instructed and should not be unnecessarily delayed. It's important from a procurement perspective to remember also that as we press for additional deliveries on an accelerated basis, we need to be able to show to the vaccine companies that Canada is indeed following the instructions that a second dose be administered in a certain time frame. So there's not only a health consideration, one ably expressed by Dr. Sharma just now, but there is also a procurement consideration that we need to take into account. Our arguments for accelerated deliveries are stronger if we can show the vaccine suppliers that indeed Canadian provinces and territories are following the instructions for the delivery and inoculation of the second dose that they have provided. Thank you.
Back to you on the phone.
Thanks. And a follow-up also for the minister. This is a question about disposable gloves. Our colleagues at Marketplace have been investigating the disposable glove industry in Malaysia, and they've been able to confirm that there are serious human rights violations, labor violations at some of the factories there. And experts are saying that there are strong indicators of forced labor. Millions of gloves from there are imported here to Canada, and some of the importers have federal contracts. And we know that these gloves are being used by hospitals here in Canada, by doctors and consumers as well. So the U.S. has recently banned the import of some of these PPE products, but Canada has yet to do so. So we're wondering why Canada isn't taking any action to stop these goods coming into the country.
Thank you so much for the question. As someone who has fought for human rights for my whole life, I take this situation very seriously. Forced labor is a significant and unacceptable problem in global supply chains. And as soon as I was made aware of this issue, I have ordered and asked my team to look into it and to discern what do our contracts say, what was the actual relationship. Our contracts for gloves in large part proceed through Canadian distributors or intermediaries. And so I've also asked my team to be in contact with those distributors. And we are working with our suppliers to investigate these allegations, to verify that their supply chains are indeed free from forced labor. As I said, it's an issue that I take personally very seriously and am working on it as we speak.
Okay, we're going to go to the room. Go ahead.
Hello, Minister Anand. This is Maan Hamidi with the Canadian Press. I want to ask you again about the recent negotiations with Pfizer and Moderna. You said that you're always in contact with them, and you said the main focus is to ramp up the deliveries of the vaccine doses. Have you offered or paid more for vaccine doses recently to guarantee larger shipments of the vaccine?
Well, thank you so much for the question. And I just want to say that our negotiations proceed on the basis that everything is on the table. We leave no stone unturned. We have sorry, my video cut out there. We have to make sure that we convey to the vaccine suppliers that we will do whatever it takes to get vaccines into this country and to do so as early as possible. And so indeed, ensuring that we had vaccines into this country prior to Christmas did involve paying fair value for those vaccines. And again, we are all on the same page of the urgency of this situation. And we will stop at nothing to ensure that we get vaccines here as early as possible.
Thank you, Minister.
One thing I would add very shortly, in addition, in its report to what Minister Anand has said, is that we, as Canadians, we should always be both mindful and proud of the strong regulatory reputation that we have outside of Canada. The fact that our regulatory agency on vaccination is so strong and has such a good reputation also helps our ability to procure and to work with pharmaceutical companies. In addition, of course, the fact that we have a strong public health system, which reassures our partners outside of Canada.
Thank you, Ministers. About 5% of test swabs for genetic variants for the novel coronavirus. Do you think that's enough, given that what you've seen in other jurisdictions, especially in England, where things now almost are out of control?
We are doing genetic sequencing at a rate that's commensurate with a lot of countries and better than most. And we are rapidly increasing that capacity as well and providing that capacity to the province and territory so that your major provinces are able to do a lot of sequencing right now. And we are also then assisting with the smaller jurisdictions, the smaller provinces as well. So as I said, we're sequencing about 5% and but also increasing our laboratory testing strategies, looking at broader surveillance, but as well as targeting different populations, such as travelers, such as super spreading events, such as if incidence is increasing, for example, in a jurisdiction, we get those samples so that we can sequence them to see if there's any variants of concern. So, I think, yeah, so much higher than some of other countries, actually. And we are able, as you've seen, to detect the UK variant, and we're looking very closely for the other variants of concern as well.
Okay, that's the end of the press conference for today. Thanks, everyone.